So I went to a skilled nursing facility recently and I was asked to come there and to do a course. And we got to something about documentation, and they produced for me they were talking about how they're using outcome measures. We're using outcome measures, they're making us use outcome measures, so we're doing our outcome measures, and we're documenting it, but we're just not seeing a change. I don't understand why we have to do it. So I asked to see their documentation system, or kind of what they're doing with the patients, and this is what I found. This is what they did. They had an exercise book where they wrote down the patient's treatment each day. So every other day, they were doing all of their outcome measures, and then they were treating the patient. And this is where this whole course comes from. They're doing outcome measures, and then they're doing completely irrelevant therapy. The whole point of this course, and the whole point of outcome measures, is it's like this. It's this clue as to how the patient's functioning in whatever area you're assessing with that functional outcome measure. And if we keep doing functional outcome measures and then doing random treatment and then doing functional outcome measures and random treatment, we're not going to see the change in the functional outcome measures if we don't change the direction of our interventions to address what the functional outcome measures are actually looking at. So if we want someone to improve their gait speed and they're doing upper extremity exercises 5 days a week, guess what? It's not going to happen. If improving their Berg score is indicative that they're ready to go home and they don't have to go to a skilled nursing facility, imagine if that was your mother or your grandmother. Okay, so let's put it in that setting. I always find that matters a lot more than just the patient. It's your mother. She goes to a skilled nursing facility, right? I don't necessarily want my mother living with me, so I'm going to use this as an example. If she doesn't do well on her Berg, the therapists are going to say what? She can't go home. All right, so she's going to come live with me if we don't get that Berg score up. I go in to see her at the therapy center, and she's on the new step, she's doing UBE, she's doing heel slides, she's kicking a beach ball across the room to somebody in another wheelchair across the room, and the therapists are telling me that she's getting stronger, we're going to improve her balance, we're doing therapy to make her better. I'm like, well, what is she having a hard time with? Well, her Berg score is low. My question would be, what part of your therapy interventions are addressing what she's not doing well on in the Berg that are indicating that she's a fall risk and you won't let her go home? If I want her to go home, we have to have interventions that are going to fix the reason why she's not doing well on the Berg test in the first place. So our therapy cannot be independent of the functional outcome measures that we're using. There should be interlinked. And so if we can find that link, if we can look at functional outcome measures instead of something that we have to do, if we can look at the functional outcome measures and say, wow, when I did this functional outcome measure, I noticed that on item number 12, she has a lot of trouble, and item number 12 is looking at this. So if I do interventions that improve that, she's going to get better on that functional outcome measure. And now we start seeing how our treatment is going to start improving function and also our functional outcome measures. And if those functional outcome measures are embedded in research and are strong with evidence-based practice in the sense that they're predictive of outcomes or how well someone's going to do, then as we start seeing the improvement in the functional outcome measures, obviously we're preparing our patients better to have less pain, to be more functional, to be able to return to work, to be able to walk faster, to be able to come back into the community.